You'll hear us refer to it throughout the presentation as PHSI, just to save ourselves some time, and oxygen. This webinar is intended for decision maker and researcher applicants who wish to learn more about the funding opportunity and ask questions about the preparation and submission of their application to CIHR. So within today's webinar, we'll provide highlights of the PHSI funding opportunity and provide suggestions for strengthening your application. We'll also highlight some of the priority research areas supported through PHSI with specific attention given to the Fostering Innovation in Healthcare initiative. There will be plenty of time at the end of the presentation for questions and answers. In addition, I just want to point out that at the end of the webinar, I'll give you an opportunity to access our expanded version of this presentation deck, which means it will include all of the information that you both see and hear today. So I'd like to introduce today's presenters. My name is Andrea Smith, and I'm the Manager of Knowledge Translation Initiatives here at CIHR. Joining me today is Dr. Philippe Couillard, former Minister of Health and Social Services in Quebec, currently serving as Chair of the RxD Health Research Foundation. Ms. Sue Gasping-Graham, Associate Director of CIHR's Strategy for Patient-Oriented Research, will join Dr. Couillard in providing you with more information about the Fostering Innovation in Healthcare initiative. Next, our CIHR Deputy Director for the PHSI funding opportunity, Alison Bouron, will provide you with application instructions to help guide you through that process. And finally, we'll hear from Dr. Walter Wadges, Associate Professor at University of Toronto, who has served on past PHSI review committees as Scientific Officer and is also a PHSI grant holder himself. He's well positioned to provide you with tips for success. We'll then open the floor to questions from you, the participants. So before we begin, we'd just like to get a bit of a sense of who's joined the webinar. So if you'll take a few minutes to just answer the following two questions. In the context of the health research community, how would you classify yourself? And in which geographical area are you located? So you'll see here on the side of your screen the poll questions that are there. So if you'll respond to those now, we'll just take a brief minute to gather your responses. And you'll see once we've gathered those responses, we'll be able to show you on the screen to give you a sense of who else is joining you on today's call. So almost everyone has now replied. We're just waiting for a couple of remaining responses. Great, so thank you very much for submitting your responses. You'll see here on the screen shortly a bit of a breakdown for who's participating today. So you'll see a large number of research administrators and independent researchers and a lot of folks from Ontario, which is to be expected. So thank you for providing that information. So let's begin with a bit of an overview of the PHSI funding opportunity. So PHSI offers Canada's health system decision makers evidence-based answers to their most pressing questions. It's a funding program founded on partnerships, and every PHSI project involves collaboration between decision makers and researchers interested in working together to address health system challenges. Any applied health services and policy research topic can be addressed so long as it responds to the information needs of the participating decision makers. So when we look at a bit of a snapshot of the PHSI program and look at relevant projects, any applied health systems and/or services research question that is deemed useful to the health system managers or policymakers is eligible. PHSI proposals must meet the objectives outlined in the funding opportunity, and I'm not going to read through those objectives now, but it's essential that you be familiar with them and outline in your proposal how you meet these objectives. As for eligibility, applications must include a researcher and a decision maker, and a partnership contribution must be secured, and that is of 20%. The CIHR funding available for this current competition is a total of $12.7 million. Funding sources for your project can be a mix of CIHR and partnership support. The maximum amount that can be requested from CIHR is $600,000 over 3 years. And finally, the KT requirement involves a comprehensive knowledge translation plan. There are several key words you'll hear mentioned with respect to the PHSI funding opportunity, and I know in going over these with you today, I'm hoping that this will provide clarity and guidance in developing your proposal and preparing your application. So you see here CIHR's definition of knowledge translation, and I'm not going to read through it, I'll leave that to you. But suffice it to say that this definition is the conceptual foundation for FSI, and in fact all of CIHR's KT funding opportunities for that matter. Looking a little more closely at the concept of integrated KT, this means that knowledge users are engaged in the entire research process, familiar to some by a variety of other labels such as collaborative or participatory research. Their engagement and involvement can vary depending on the nature of the project, but at a minimum, we believe they should work together with the researchers to shape the research questions, interpret the findings, and move the results into practice. They can then go beyond that to be involved with additional activities such as deciding on the methodology, data collection and tools development, and widespread dissemination and application, again depending on what's appropriate for the project. Knowledge user is an official applicant category at CIHR to recognize the participation of knowledge users in integrated knowledge translation projects. With IKT projects, there's a greater expectation that the findings or recommendations will be acted on. The participating knowledge users should have enough decision-making authority to integrate knowledge into their working environment. Some examples of knowledge users include practitioners, policymakers, educators, healthcare administrators, community leaders, or an individual in a health charity, patient group, private sector organization, or a media outlet. Now, when we look at the FSI funding opportunity and talk about decision makers, this is a knowledge user who has the authority to influence or make decisions about health policy or the delivery of health services. In the FSI competition, a decision maker is typically a health system manager, policymaker, or clinician leader that is capable of making significant changes to policy or practice. So there are two applicant roles to recognize the participation of decision makers and other types of knowledge users in FSI projects: principal knowledge user and knowledge user. At least one decision maker must be involved in each application as the principal knowledge user. Additional decision makers can be listed on the grant in either the role principal knowledge user or knowledge user. Because of the strong partnerships component of FSI, the various partnership arrangements and requirements can seem somewhat confusing. In order to be eligible for a FSI grant, applications must secure a minimum partnership contribution equal to 20% of the total grant amount requested from CIHR. Partnership contributions must be secured at the time of application, and that support can be in-kind or cash or a combination of both. Some examples of in-kind support can include access to unique databases, professional analytical or other services, employee salaries, equipment, materials, technology, software, etc. There are two sources for this support: competition partners and project-specific partners. Competition partners are organizations with established agreements with CIHR and are listed in the Partner Collaborator section of the funding opportunity. In most cases, they need to be contacted with a request for support 6 weeks before the FSI application deadline. So for example, August 31st for FRQS and September 17th for all other competition partners. This in consideration of a November 1st, 2012 application deadline to CIHR. The project-specific partners are often linked to the decision-maker team member. To illustrate how the various partner funding contributions might contribute to the overall project budget, we've pulled together the following example. So in this example, the total amount requested from CIHR for the proposed FSI project is $400,000, then requiring an $80,000 or 20% amount in partnered funding support. This team has secured that leveraged funding from both a competition partner and a project-specific partner. In this instance, the competition partner provided cash support, while the project-specific partner committed $35,000 in-kind support. So let's broaden these examples to further illustrate not just the partnership funding arrangement, but the type of projects that are funded through the FSI grant. The project presented here was funded in the previous FSI competition, and we'll look at comparing the effectiveness and cost effectiveness of two provincial, that's Nova Scotia and New Brunswick, early intensive behavioral intervention programs for children diagnosed with autistic spectrum disorder, data for which are currently lacking. The government decision makers on the research team require this data to make critical policy decisions. In this instance, the nominated principal applicant, Isabel Smith, is an independent researcher, and so we see that the team then includes Patricia Murray, a decision maker, as their principal knowledge user. For this project, the required partner contribution came from competition partners. Since the study was cross-jurisdictional in nature, two different competition partners committed their support to the study. In the next example, Dr. Nora Lou Roos and her team aim to improve the understanding of health policy research evidence by journalists and ensure it's accurately communicated to Canadians and policymakers via the media, more specifically through evidencenetwork.ca, a nonpartisan health policy news resource. Again, we see that the nominated principal applicant was Dr. Roos, an independent researcher. And so we see Ms. Nuama as the principal knowledge user, ensuring strong IKT engagement, direction, and commitment on the part of both researcher and decision maker. A number of other decision makers are also listed on this grant in the knowledge user role. For the partnership contribution, we see the commitment coming from both a competition partner and a number of project-specific partners. The project-specific partners contributed in-kind support, while the competition partner has committed cash support. In this instance, the team has more than met their 20% required partner contribution. And again, this requirement is on the amount requested from CIHR, not the total project budget. Of the funding requested from CIHR, so that's a maximum of $600,000 per grant over the 3 years, strategic partners will support applications relevant to the PHSI objectives and their research priority areas. These strategic partners are primarily CIHR institutes, initiatives, and branches, but you'll see here that some external organizations like the Mental Health Commission of Canada and RxND have partnered with CIHR institutes or initiatives to support specific research priorities through funding tools like PHSI. Descriptions of the priorities for these strategic partners can be found within the Partner Collaborator section of the funding opportunity. We'd now like to provide a little more in-depth information on one particular strategic initiative partnered on this PHSI competition, the Fostering Innovation in Healthcare Initiative. I'd like to hand off to Ms. Sue Gaskin-Graham and Dr. Philippe Couillard to speak in more detail about this exciting initiative built on a partnership between CIHR SPORE and the RxND Health Research Foundation. Sue?
Thank you. As you mentioned, Andrea, the Fostering Innovation in Healthcare Initiative represents a partnership between CIHR's Strategy for Patient-Oriented Research and RxND's Health Research Foundation. The goal of this initiative is to fund research that will increase the value of the healthcare system from the perspective of the patient. And we're going to do that by supporting patient-oriented innovations aimed at enhancing the quality and the efficiency of healthcare delivery. Applicants are required to demonstrate how their research includes both healthcare decision makers and patients as active partners in the research. These innovative projects will position research as close to patient values as possible to improve the sustainability and patient satisfaction. As a strategic partner, the initiative offers an additional $7.2 million in funding committed to the 2012-13 PHSI competition, and that's $3 million from each of the RxND and CIHR partnership, plus an additional $1.2 million that we're projecting from the external partners that the applicants will bring in. The CIHR Strategy for Patient-Oriented Research, which you probably heard referred to as SPORE, aims to demonstrably improve health outcomes and enhance patients' healthcare experience through the integration of evidence at all levels in the healthcare system. The goals that we have to achieve this vision are to rattle them off, to create a collaborative pan-Canadian process for identifying, establishing, and addressing patient-oriented research priorities, establish an integrated leading-edge pan-Canadian clinical research infrastructure along the full continuum of patient-oriented research, grow Canada's capacity to attract, train, and mentor healthcare professionals and health researchers, as well as to create sustainable career paths in patient-oriented research, strengthen organizational, regulatory, and financial support for clinical studies in Canada, and enhance patient and clinician engagement in these studies, and improve processes for the early identification of best practices, expedite their development and harmonization into guidelines for patient care, and support their adoption by clinicians, caregivers, and patients. Dr. Couillard will now speak more about the RxND Health Research Foundation and provide you with an illustration of the type of PHSI project that might be funded by this initiative. Dr. Couillard?
Hello, can you hear me? Yes?
Yes, we can, Dr. Couillard. The floor is yours.
Thank you. Welcome to all. So the RxND Health Research Foundation, also known as HRF, is a non-profit organization whose mission is to support health research in Canadian academic health centers and to promote the value of health research in our country. Founded in 1964 by Canada's research-based pharmaceutical companies, the HRF applies the highest standards of scientific excellence to address health challenges of great importance to Canadian society. It accomplishes this through a long-standing tradition of establishing partnerships with the academic field and government. As one of the leading private health research foundations in the country, the HRF contributes significantly to the prevention and treatment of disease and to a better healthcare system. The HRF, in collaboration with the Canadian Institutes of Health Research, has provided over $27 million in funding to more than 1,700 researchers across Canada. To be considered for CRHR, SPOR, RX, and the HRF funding, projects must meet the following relevance criteria. First, and very importantly, there must be a significant and meaningful level of input from patients and organizations impacted by the project's area of focus throughout the entire project, including patient representation in the research development, planning, and validation phases, a high level of importance given to the measurement of patient experience as a major endpoint by using published available tools, and patient participation in the final evaluation of the project. The 20% partnership funding requirement from PHSI competition partners and or project-specific partners must be from publicly funded and or not-for-profit agencies and organizations. I would now like to share an example of a project that was funded in the previous PHSI competition, but would have been relevant for this initiative had the applicants applied for this current competition. Dr. Shu Li and his team are leading a research decision-maker team where they are evaluating a new model of care in neonatal intensive care units developed at Mount Sinai Hospital. In this new approach, parents provide all except the most advanced medical care for infants instead of nurses. Initial study of the family integrated care model has shown to be improving health outcomes while being safe and cost-effective. The PHSI grant is allowing researchers to evaluate this innovative way of providing care in other centers across Canada. For this project, Dr. Li's team meets the relevance criteria mentioned in the previous slide, in that they have significant engagement throughout the research process from family advisory committees and veteran parents. Patient experience is measured throughout using a standardized tool. And patient representation on the steering committee ensures involvement in the final evaluation of the project. And finally, the project team secured their 20% required partner funding from the Ontario Ministry of Health and Long-Term Care, of course, a publicly funded agency. Hopefully, this gives an illustration of the kind of patient-oriented research this particular initiative aims to fund through the PHSI competition. If your project aligns with the Fostering Innovation in Healthcare initiative, you must articulate in a separate document how the project addresses the goal and the specific relevance criteria for this initiative with 1 page maximum. Funded teams will be required to submit a mid-project report to track progress against stated milestones. Thank you for your time today.
Thank you, Dr. Couillard and Ms. Gaskin-Graham. Just a quick comment regarding the priorities for our strategic partners. Your project may align with the research priorities of one or more of the other strategic partners. With the exception of the Fostering Innovation in Healthcare initiative, which requires a 1-page relevance submission, relevance for the other priorities are flagged by the strategic partners during relevance review. So for instance, in the previous example, the integrated care model for NICU, it would be relevant for the Fostering Innovation in Healthcare initiative and for the Institute of Health Services and Policy Research's priority research areas. The applicant team would have submitted the additional 1-page relevance document for the Fostering Innovation in Healthcare initiative along with their application, and IHSPR would have flagged the project as relevant during the relevance review stage. Okay, so we'd like to get a sense for how many of you joining today are interested in the Fostering Innovation in Healthcare Initiative and are considering flagging relevance when submitting your proposal. So once again, we'll do another quick survey, and for those of you that are having difficulty with the surveys, our apologies. But for those of you who can complete the survey above, please take a moment to answer the question you see on your screen. So do you feel that your proposed project aligns with the Fostering Innovation in Healthcare Initiative? Yes, no, uncertain, or not applicable? We'll just take a couple of seconds here. Okay, we just have a few remaining respondents, and we will momentarily see the answers on our screen. Great. All right, so in just a few seconds, you should see showing on your screen the breakdown from that previous survey question. And so it looks like there are a number of folks on the line that are still uncertain about alignment with the initiative, and I certainly encourage you to follow up with us after today if you'd like to get more answers to some of your questions about the initiative. We'd be happy to talk more with you about that. So in evaluating PHSI proposals, the Merit Review Committee uses the following criteria. So I'm sorry. I'm just going to move on to our next slide here. We're going to cover the last term, which is merit review. So I was jumping ahead of myself there. So with merit review, by requiring both researchers and knowledge users to be part of the research team, integrated KT requires merit review. Both knowledge users and researchers are on the review panel, and each proposal is reviewed by at least one of each. Knowledge users are not required to have academic backgrounds. Expertise is often related to their experience. Each proposal is scored on both potential impact and scientific merit. Only applications rated 3.5 or higher on both potential impact and scientific merit are eligible for CIHR funding. In evaluating PHSI proposals, the Merit Review Committee uses the following criteria: research question, which is an explanation of the research project and justification for the need to conduct the research; research approach, which is a detailed description of the research approach and justification for the proposed methods or strategy; feasibility; and outcomes. Within the funding opportunity, you'll see specific questions that apply to each of these criteria, and it's important to respond to all of these questions. So Dr. Watches will provide some clarification on this later in the webinar. Finally, we recognize that the partnership building and planning that goes into IKT research, like the work funded through PHSI, can be very resource intensive, and for that reason, we've created the PHSI Planning Grant. This grant is intended to provide the opportunity for researchers and decision makers to apply for development funds to facilitate the formation and development of partnerships between researchers and decision makers interested in applying to PHSI. So the amount of funding available for this particular grant is up to $25,000 per grant, and applications are accepted 3 times a year, in October, February, and June. So the current deadline for this competition running at the moment is October 15th, 2012. I'll now pass things over to Alison Burgon to go over some application instructions. Alison?
So the next few slides will present key information on specific requirements of this program. When preparing a PHSI grant, there are 4 different applicant types. The nominated principal applicant is the individual who will be responsible for the direction of proposed activities and who will assume the administrative and financial responsibility for the grant. Specific to PHSI, the nominated principal applicant can be an independent researcher or a knowledge user. A principal applicant is an individual who shares responsibility for the direction of the proposed activities. Once again, for PHSI, a principal applicant can be an independent researcher or a knowledge user. There are different terms in ResearchNet to identify principal applicants who are independent researchers versus knowledge users. If a principal applicant is a researcher, in ResearchNet they should be identified using the principal applicant term. Alternatively, if a principal applicant is a knowledge user, they should be identified in ResearchNet as a principal knowledge user. For PHSI, the first 2 roles on this slide are mandatory, while the last 2 are optional. A co-applicant is an individual who contributes to the proposed activities. For Physy, this individual can be an independent researcher, a knowledge user, or a trainee. Once again, in ResearchNet, if a co-applicant is a researcher or a trainee, they should be identified as using the co-applicant term. But if a co-applicant is a knowledge user, they should be identified in ResearchNet as a knowledge user. And finally, a collaborator is an individual who provides a specific service or intellectual support to the project. The next few slides will outline applicant requirements. In order for a Physy application to be eligible, it must include at least 2 principal applicants, one who is an independent researcher and one who is a knowledge user. This means that if the nominated principal applicant is an independent researcher, you must also identify a principal applicant who is a decision maker. As a reminder, in ResearchNet, this individual must be identified as a principal knowledge user. If the nominated principal applicant is a knowledge user, you must also identify a principal applicant who is an independent researcher. Please note that there is no maximum number of principal applicants or principal knowledge users who can be identified on a grant. Also, there is no limit to the number of applications on which an individual can participate as long as the content of these applications is different. It is important to know that the roles you select when identifying participants in ResearchNet will determine which CV type is required for each applicant. For independent researchers, a full common CV is required for the nominated principal applicant if he or she is an independent researcher, for principal applicants, and for co-applicants. For knowledge users, a knowledge user common CV is required for the nominated principal applicant if he or she is indicated a knowledge user role, for principal knowledge users and knowledge users. Collaborators are not required to submit a CV. Moving to partnership requirements, this slide outlines the documents that must be provided for an application to be eligible. A signed partnership details form must be completed and signed by all competition partners. For any project-specific partners you secure, you must provide a completed and signed partnership details form as well as a signed letter of support. It is very important to note that the minimum partnership contribution required of 20% must be met at the time of application, and that the partnership details form will be used to confirm partnership contributions. As such, those partnerships for which a signed partnership details form is not provided at the time of application will not count towards the contribution requirement. As previously mentioned, partnership contributions can be a combination of cash or in-kind contributions, and there is no upper limit on partner contributions to a project. This slide summarizes the letter of support requirements for Physy. A signed letter of support is only required for project-specific partners. However, all knowledge user applicants are strongly encouraged to submit a signed letter describing their role and involvement in the project, the amount of time they are contributing to this project, any cash or in-kind contributions they will be making, and a description of how they intend to use the results of this research project. The Merit Review Committee reads these letters carefully to assess the degree of commitment of the knowledge user applicants. Decision makers are advised to personally write their letters rather than sign a template letter. They're also encouraged to refer to the CHR Guide to Writing Letters of Support for additional guidance, and a link to this document can be found in the funding opportunity and will be included in the download from this session. Additional requirements associated with the Physy application include a research proposal and budget request. The research proposal is limited to 13 pages. The first 12 pages of the proposal should address the evaluation criteria, and the last page must outline the main activities and milestones for the proposed funding period in a diagram form. For the budget, the financial assistance template should be completed to include cash and/or in-kind amounts to be covered by project-specific and competition partners. The budget requested from CHR must be listed under the CHR column. Similarly, contributions to partners must be listed in the other funding column and must total the amounts listed in the partnership details form. Applicants should also attach a document with a justification for all project costs, including those associated with the knowledge translation plan. And as a final note, I'd just like to highlight that the Physy program does use the electronic approval of applications process. So this means that applications must be submitted to your institution page by the deadline that will be available to you in ResearchNet.
Thank you, Allison. Dr. Walter Walchus will now join us to give you some suggestions to help in strengthening your Physy application. Welcome, Dr. Walchus.
Hello, Dr. Walchus. Could Yes, we can hear you.
Good.
Wonderful. No, not a problem.
Thank you, everybody. So I just wanted to have a thanks for the opportunity to bring, I think, a couple of points out that researchers and knowledge users applying to these funds might find useful. So the thing to really keep in mind throughout all of the development and of the grant is the two sides, the scientific merit and the potential impact, and they're really equally weighted throughout. So right from the research question, understanding that there's an explanation of the research project and justification for the need to conduct the research. So what this means is being clear about the question is right away, being clear about the origin of the research question, why it's interesting, and how does it align with health system priorities and the organizational priorities of the decision-making partners. This is really key to ask an important scientific research question that is not currently relevant or won't be relevant to the decision-maker partners is not going to be viewed very positively by the committee. So demonstrating that that question has been shaped by the participating decision-makers and responds to their needs is really key. And then outlining how the project responds to the objectives of the specific funding opportunity as well, especially if there are strategic options. In the research approach, a detailed description of the research approach is needed, as well as a justification for the proposed methods and strategies. This is really, the science behind it. Being clear and specific about the proposed methods. So don't assume that the committee is familiar with the methodology. We see everything from very sophisticated statistical modeling to participatory action type research, very qualitative approaches. So being clear about that, everybody won't have the same background. Justify your approach. Someone on the committee is bound to disagree with you. So you just need to be clear that your approach, why it's the best one, and how it will answer that research question. Include a reasonable, both integrated and end-of-grant knowledge translation plan that's appropriate for the goals and audiences. Distinguish between different audiences, the decision makers participating in the project and other target audiences that might be reached by the dissemination plans. In the feasibility, it's a demonstration that the researcher decision maker team has the requisite skills, experiences, and resources to complete the project within the proposed time frame. So document the expertise of each team member, and particularly the role that they play in the proposed study. Being clear about why each team member is on the team, what their strengths are, and how they're able to do the work. Demonstrate that it's a doable study, both from a scientific and a practical perspective. It's also important to link the knowledge translation activities with the budget justification as well in the feasibility, ensuring that you have enough money to do what you want to do. Include a fair amount of detail about the decision makers, particularly their role in the project and evidence that they understand and have agreed to fulfill their role, their commitments to use the results of the study, and to move them into action where appropriate. And this is really about demonstrating a pull for the results. We don't just want research that researchers go off and do and then hand over a book or a report to a decision maker. It really has to be something that the decision maker is looking for and seeking that information. Justification that they're the right decision makers, both to inform the project and particularly to act on the findings. And evidence of an ongoing commitment from the organization as well as the decision maker is ideal. Financial and in-kind support from the decision maker's organization is a good sign of engagement and commitment to the project. And we say the organizational aspect as well as the individual because sometimes a person in a particular role in an organization may change over the course of the project. Very strong integrated knowledge translation projects will demonstrate an established relationship with the decision makers and one that hopefully proceeds and will outlast the particular project. Finally, thinking about the outcomes, the most important outcome is successful uptake of project findings by the decision makers. So consider the potential impact of your study and its transferability, also to other potential decision makers outside of your team. Illustrate how it will have a substantive and sustainable impact on health outcomes, practice, programs, and/or policy in the study context. While the project's intended to respond to the needs of participating decision makers, findings can have greater impact depending on the extent to which the results are transferable to other contexts. So I mentioned this a little bit already. And it should be transferable enough that other similar audiences will benefit. One project within a single organization, a single hospital or community center that doesn't look like it can expand to other centers won't be viewed to have that same impact. If it's not transferable, acknowledge and justify this, that it's important enough. Develop a reasonable evaluation plan to be able to assess the outcomes and impacts of your study as well. So just a couple general final tips before you start writing your application and before submitting your application. So before you start, read and understand all the requirements, contact CIHR if you're unsure about anything, potentially seek a mentor, someone who's been successful in the competition, and invest enough time to prepare. In writing the application, establish the need, importance, and originality of your research, how it fits into the larger scheme of things. Clearly articulate the theoretical or conceptual framework. Don't neglect the literature review. So it should really be, conceptually coherent and ideally theoretically driven. Write with the reviewers in mind. Reviewers don't simply read, they interpret, right? So make sure that if you want them interpreting things a certain way, give them what they need. Keep in mind that your application will be reviewed by both the decision makers and knowledge users. And the committee is really very balanced in that respect as well. Ensure the proposal flows logically. This is sort of standard grant writing, clearly written, easy to read, right? Make it easy to read. Consider structuring your application to reflect the review criteria. Avoid use of, imprecise words, jargon, unusual abbreviations, all those types of things. Have good grammar. If your application is unsuccessful, definitely consider rewriting the application to address the comments and reapplying. Take those comments to heart. People put time and effort into them. Be brief and courteous if you're providing a response to previous reviews, and address the most important criticisms, both factually and professionally. Before submitting, you can't say enough about proofreading, revising, getting the message as clear as possible. Perhaps have other people review your application, not just the collaborators, but someone outside. And recognizing that greater clarification in the proposal might be warranted, even if you think you've done a good job. Someone else will be reading it for a first time, not familiar necessarily with the topic. They will be knowledgeable, but they may not be expert. So some of the areas for improvement, just as a general note that have been identified from past review committees. One, first off, is low potential impact, or not generalizable, just too narrow and focused of a topic. A lack of a theoretical rationale or an incoherent theory that just lays out some objectives without a clear justification. Lacking specificity in the methodology. The science side has to be strong, be really clear. Also, an important point is, where applicable, be very clear. A lot of these projects have gender-based analysis, would be very appropriate, and highlighting that will be important to consider. Lacking expertise on the team is sometimes a problem, and lacking meaningful engagement from decision maker and team makers. I'd say that's a really fundamental flaw if it's not there and shown to be very strong. So that's just some of the tips I'd have.
Thank you very much, Dr. Watches. That was very, very helpful. You'll see now on the screen in front of you that we've listed the key dates for the competition here, with the deadline for securing competition partner support coming up next week on September 17th. That is with the exception of FRQS, where that deadline is already passed. The final deadline for your complete CIHR submission is November 1st, 2012. So we'll start the Q&A portion of the webinar momentarily, but should you have any questions after today, please contact us. So for questions specific to the application process, please contact Anne-Marie Poulin. For questions of a more strategic nature, for example, does my proposed project align with the FSI objectives, please contact me, Andrea Smith. We've also listed here several contact links you might find helpful as you're preparing your submission on research.